We're delighted to offer a wide variety of benefits that will assist both you and your family. This presentation will give you an overview of the many benefits our associates enjoy. If you have any questions regarding our offerings, please feel free to contact the Human Resource Department with questions. At Redwood, your salary is just a portion of your compensation. We offer a wide variety of benefits that will protect and help you and your family. Some of our benefits are paid at 100% by your employer. Some are partially paid by your employer, and some are offered to you at a low cost via payroll deduction. Your benefits start the first of the month following 30 days of employment. Employees that start on March 5th will be eligible to start benefits on May 1st. We have an online system that allows you to review your benefits, obtain information about our plans, link to the carrier websites, obtain forms, and review the actual plans. When you go online, you'll be asked to make your benefit elections. These elections are then fixed till our open enrollment on October 1st of each year, unless you have a special event like marriage, death, divorce, or birth of a child. We will now review the benefits. All employees will benefit from a $25,000 life insurance policy and a $25,000 accidental death policy at no cost. When you enroll, you'll be asked to identify beneficiaries in the event of your death. All employees are also protected if they are sick or injured and unable to work. After 90 days of disability, you'll receive 60% of your pre-disability salary to a maximum of $10,000 per month. The income will continue as long as you remain disabled or until age 65. And because you will pay taxes on the premium of this benefit, the actual disability benefits will not be taxable. Another important benefit is our Employee Assistance Plan. A confidential 24/7 hotline is staffed for you and your family members, even if you don't take our medical plans. They can refer you to a local counselor or other resource for problems with relationships, children, substance abuse, stress, anxiety, job pressures, grief, and loss. Also included are legal resources and financial planning. One of the most important benefits offered is, of course, the medical plan. Our associates in the Chicagoland metropolitan area have 3 options, and associates around the country have 2 great options to consider. The 2 PPO plans offer a worldwide network of providers. All offer discounts on a wide variety of items like health clubs, vitamins, and vision care. All 3 plans offer 100% preventive care and coaching and management of many serious medical issues like asthma or diabetes. All of our plans have a copay for prescription drugs. You can purchase up to a 30-day supply at a retail location. Copay will depend upon the type of medication: generic, brand on the preferred or formulary list, brand not on the preferred or formulary list. The formulary list can be obtained online. Emergency rooms are the most costly place to obtain service. A $150 copay is assessed for each visit. All plans pay 100% for routine preventive care. A list can be found online of suggested tests based on age and gender. Many times the doctor will not code the visit as preventive, and you will have to pay a copay for the visit. Make sure that the doctor's office understands that your plan pays for preventive coverage. When you visit a doctor for an office visit, you will pay $20 for a primary care doctor, pediatrician, internist, OB, or $40 for a specialist. Only the HMO is available for members that live in the Chicago metropolitan area. This plan requires each participant to select a primary care provider. That provider will control all care. There is no coverage for non-referred or out-of-network coverage unless there's an emergency. Coverage is paid at 100% for referred services. The other plans available are a $500 deductible plan and a $3,500 deductible plan. Each calendar year, a person must pay all charges up to the deductible. Then the 500 plan pays bills at 90%, and the high deductible plan pays 80% for all charges until the maximum out-of-pocket is reached. Bills after that are paid at 100%. There is no annual or lifetime maximum on the plan. Note that out-of-network charges are subject to a much higher out-of-pocket cost. The good news is that Blue Cross has almost all doctors and hospitals in the United States on their plan. Check the website to confirm. We have found that most doctors participate with Blue Cross. The major out-of-network culprits are cosmetic surgeons and therapists like MSWs and psychologists. We offer 2 dental plans through MetLife. Our high plan has a $1,500 annual maximum and a $1,500 lifetime maximum for orthodontia for dependent children only. Preventive care is paid at 100%, and basic, major, and orthodontia is subject to a $50 annual deductible. Our low plan, which is less expensive, has a $1,000 maximum for in-network dentists and $500 maximum for out-of-network dentists. There's a $50 annual deductible for all charges except for preventive in-network and $150 for out-of-network, and no orthodontia. The plan pays 100% for preventive in-network, but only 60% for preventive out-of-network, 80% for basic in-network, and 40% for basic out-of-network, and 50% for major charges in-network, and only 10% for basic charges out-of-network. To find a network dentist, go to www.metlife.com/dental, and you can put in your zip code, and the network you're going to look at is PDP+. VSP offers a great vision plan. Every 12 months you can get an eye exam with a participating doctor for $10, and every 24 months you can get new frames or contacts, but not both, for $25. It's always better if you use in-network providers, but if you don't, you do get a reasonable allowance. While we offer long-term disability for catastrophe protection, you might want to reduce your family's risk by purchasing coverage for the period of 8 days to 13 weeks of disability. This coverage is based on your income and your age. The plan pays 60% of your pre-disability salary up to a maximum of $3,000 a week, and it pays as long as you remain disabled for up to 13 weeks. This benefit is not taxable because you will pay premiums with post-tax income. This does cover maternity, but only as long as the mother is physically unable to work. If she is able to work but wants to stay home with the baby, this is not covered. When you are first effective, you get a one-time opportunity to purchase up to $150,000 of life insurance coverage with no questions asked. You can also purchase up to 50% of what you purchase for yourself, for your spouse up to $250,000, and up to $10,000 for your kids. You can purchase additional amounts, but anything over the $150,000 limit is subject to providing your good health. The rates go up as you age, and the coverage is portable should you leave Redwood. The ease of obtaining coverage without a medical exam and payroll deductions make it a very popular benefit. We sometimes don't feel well after hours, and it's great to be able to call a real doctor 24/7. For $10 a month, anyone in your family can call and have a licensed physician call back quickly and discuss medical issues. If appropriate, the doctor can call a prescription into your pharmacy. Great for kids away at school, great for people too busy to see a doctor, great for people with young kids. They'll also work in conjunction with your primary care physician. Our pets are also our family, and when they get sick, it can cause a huge problem for our pocketbook. By purchasing pet insurance, you can make sure that your beloved pet is able to get medical services when needed. We will also help you plan for your retirement. We will match 25% of whatever you set aside, up to a maximum of 1% of your salary. You can invest your money in a variety of funds, and you can borrow from your plan. You can also make a hardship withdrawal, although not recommended. This money stays with you if you were to leave Redwood. You can defer up to $2,550 per year pre-tax to pay for your out-of-pocket medical, dental, and vision costs on a pre-tax basis. This plan also allows you to set aside pre-tax money for dependent care. The enrollment is only available every January 1st. Redwood offers discounts for Fitness Formula Club and X Sport. Please see Human Resources for information. Right now, the important thing is to sign up on benefits online. You'll see how to do that in the next slide. Also, once you get your ID card, sign up at Blue Cross Blue Shield. You can obtain claim information online and participate in activities that help you get reimbursement. You can also take a health risk assessment that will help give you some information about your current health status and how to improve it. All the details on your benefits and the costs are available on our website at the link above. During the year, you will be able to go back and look at this information, but will not be able to make any changes until our next open enrollment on October 1st, unless you have a special life event. Your username is made up of the first 6 letters of your last name, followed by your first initial of your first name, and the last 4 numbers of your Social Security number. The initial password is your Social Security number, and you'll be immediately prompted to change it. When you enroll, you'll have to elect or reject each benefit offered. You will also see information available for each plan. At the end of the selection, you'll have to identify who you want as a beneficiary on your life insurance. You can pick different beneficiaries for basic and voluntary life, and you can pick primary and contingent beneficiaries. At the end of the selection, you'll be able to print off those selections, and they'll match your payroll deductions. If you have any questions, please feel free to contact Human Resources. For specific issues related to Benefits Connect, our online website, such as logins and passwords, please call the number above. In addition, you're free to call our brokers at the following numbers. You can go online to our benefits portal, but you can also access a lot of information with our various benefit partners.